And I'm now joined live from Tekirdağ in Turkey by Dr. Necat Altuntaş, who's an associate professor at Tekirdağ Devlet Hospital. Dr. Altuntaş, thank you so much for joining me today here on Anews. Could I start off by asking you, what is the general situation regarding the coronavirus pandemic here in Turkey?
Thank you for having me.
Pleasure.
When we look at the numbers here in Turkey, we have 9,000 cases and 600 patients, and the number of the deaths are around 75. The numbers for yesterday. Our numbers 2 months ago increased up to the 35,000 2 months ago, but with the lockdown measurements and the precautions, the number dropped 5,000. I remember maybe 3 weeks ago. But the numbers started to rise up to the 9,000 again, especially when we look at the numbers yesterday. Because, and I think that precautions are very effective in this reduction. But on the other hand, with this decrease, our citizens start to don't pay attention to this measurement again, and they started visiting their families, their mothers and fathers, and they started talking with their friends. So the numbers are increasing again because the 9,000 is very high for our healthcare system. But on the other side, I can say that our fight against the virus is going well, but no action is taken. The third wave will begin again. So we have to be very careful. We are on the knife edge at the moment. So we are going very well, but on the other side, we should be very careful, Andy.
We should do better. But how through all of this over the last year, obviously all around the world, there's been a new experience in many ways, both for individuals learning what it's like to live in a pandemic, but more importantly for the medical staff that are taking care of patients. How have Turkey's hospitals adapted, and how are they coping with this, and how are the medical staff keeping up?
When we look at the bed occupancy rates, especially in the intensive care rate, today is 60%, and the ventilator occupancy rate is around 30%. But during the peak of the pandemic, the ventilator occupancy was up to the 60%, and the intensive care occupancy was up to the 90%. So the doctors at that moment, they were burned out. But now, today, especially nowadays, in a very good situation, in our hospital, I'm not working in a government hospital, I'm working in a university hospital. There's a little difference. Mm-hmm. So in our university hospital, we don't have any COVID-19 patients. But in our city, in the government hospital, they have a few COVID-19 patients, but they are not in the ordinary places. They are only in the intensive care units. So I think we are especially the healthcare system, in a very good situation. We are not overburdened now.
So it's been very intelligently managed by the sound of things.
Yes.
And also some special hospitals were set up, for example, at the old Atatürk Airport in Istanbul. How have they managed to make it easier for healthcare?
I mean, yes, we have the hospital in the Atatürk Airport now. I don't know if they accept the patients or no. Maybe you know the subject better than me because you are broadcasting, you're giving news better than me. But I don't know. But on the other side, we are handling very, very nice. And when any coronavirus patient comes to our hospital, we easily accept them. We can easily handle them. We don't have any problem at the moment here in Turkey. It's not just like especially in England, especially the city camps. So we are in a good situation now.
Excellent, excellent. And now, of course, the way that we expect to come out of this is, of course, to get rid of all new cases. And key to that is the vaccination campaign. So that started, I believe, on the 14th of January. How has the vaccination been rolling out across Turkey?
So when we compare vaccination here in Turkey, we are at the 8th rank in the world ranking. And until now, as you said, approximately 90 million of our citizens got their first job. And, we first started the people aged over the 85 or 95. Then we finally come over to 65. Today, we started jobbing for teachers and the other government officials in Turkey. So we are in a very high rank now, at the 8th rank. I think it's a very good number now. It makes it 3% of our population now.
This is moving on very well. Now, you just mentioned that some educators have now, the vaccinations have begun for them. As we know here in Turkey, the schools have been pretty much closed across the country until recently, when village schools have started to open. And of course, there have been weekend and nighttime curfews or lockdowns, as they're termed elsewhere. How important is that? And do you see that we might be leaving those lockdown scenarios anytime soon?
Yeah, it's a good question. For normalization, normalization can be achieved by two ways. The first one is the jabbing, or finding a medication for the virus. The second one is the viral mutation. If the virus gets mutated, it will not get a chance to enter your body. But for now, we should forget the mutation of the virus, because the mutation does not depend on us. It depends on the mercy of the virus. So we should only talk about for vaccination. So far, 200 million people have been vaccinated worldwide. In Turkey, as I said before, around 3% of the population has been fully vaccinated. Estimates suggest that 70% of Turkish people will be at least partially vaccinated by mid-September, I think, at this current pace. So we know that between 75 and the 80% of the population will need to be vaccinated before the country reaches herd immunity. So my vision will be that we get there by the end of the summer, so that students can go back to the school this September.
Well, I know my son is very keen, surprisingly very keen to go to school. He's enjoying his online education, but he misses his friends, of course. So obviously we're hoping that the lockdowns will be relieved somewhat sooner rather than later. But in the meantime, can you just, it's something we need to keep repeating every time. What do people need to keep on doing to get rid of this pandemic, even if they've been vaccinated?
So as you know, it takes 1 to 2 weeks after the second shot to achieve the maximum level of protection from COVID-19. We call this period so-called, in a Latin, window period. Even after first shot, protective effect of the vaccines are high during this window period, but you can get the virus. So you should be, the people should be very careful. And during this period, they should protect themselves from the virus after the vaccination, after the second jab. And secondly, it is unknown that how long immunity will last after a person fully vaccinated, and only time will reveal this answer. Even after vaccination, maybe we will call the people vaccination after 6 months later, because we don't know how long the effect of this vaccine will last. That's why even after vaccination, people should wear mask. Why? Because it's an open question. How much people who have had the vaccine will be able to transmit the virus to the other people? So we don't answer until we find this answer, or until the last person who get the injection. We should keep wearing the mask. Even after vaccination, when people travel another countries, they should also be careful, because we need to be aware that we cannot at this time predict when new variants will arise, and when they will arise, whether you will be protected. But we don't know we are protected from the new strains of the virus. And, you know, in Turkey, we have the, maybe we have the B117 strain, but on the other side, we will have the other strain, just like the 1357 strain in South Africa. So the people who go to the another countries should be careful. So in a nitty-gritty, I'm going to say that people should wear the face mask on the first side. The second, when they go to the another countries, even after lockdown, they should be very careful.
Well, thank you so much for that advice. And let's hope there's still people who haven't listened to it. Let's hope that everybody takes their individual responsibility clearly and we can get rid of this as soon as possible. Dr. Nejat Altantash, thank you so much for joining me today here on Anews.
Thank you.
Thank you.
Thanks for having me. Thank you. Bye-bye.